Welcome to The Bone, the podcast that goes deeper. Here we cut through the noise and get straight to the core of the issues that matter. From real stories to raw truths, we dive deep into the conversations that shape our world and challenge our thinking. We're not afraid to dig in and get to the marrow of it all. Whether it's life, culture, or business in sports medicine, we're here to break it down raw and real. No filters, no fluff, just to the bone. With your host, Shelby Daly, we're getting to the bone. This is a clinically pressed, approved CEU podcast. Find the quiz to gain credit at clinicallypressed.org/courses. Clinically Pressed Company, making the complicated simple through results that give back. Find out more at clinicallypressed.org. Let's get started.
Welcome back to the Bone. Today we have Mikey Stant, and he and I got in contact on LinkedIn because he's put out an ROI calculator application. And today we are going to talk about ROI and health care or health economics. And, we'll see where the conversation goes and what interesting facts we can pull out of the air.
Yeah, no, and I'll even go back to kind of where my interest came from this. So, I'm an athletic trainer for 11 years. I started off in the college setting. And I think probably for most athletic trainers, especially during that time, COVID happens and you just start going, how do I justify my job, right?
Yep.
How do I actually come to a spot and be like, hey, this is why I should be here. So college I was working at, I started doing pretty much what's the beginnings of that ROI calculator that I put out, which is, and most EMRs do this, you can go and shadow bill, I guess what I would call it. You would match a code to whatever treatment you're doing for an injury. It would tell you, hey, this is how much you would bill insurance in a sense. And you go from there. So when I was there, I did it for the entire time I'm there, but I did it for a year. I brought it to my boss and I said, hey, is this something we could use to, for COVID, not just justify jobs, but hey, can we justify salary raises and stuff along that? I kind of got laughed at, to be perfectly honest. And so, right, before we even start this conversation is you got to have the right leadership in place and you got to have the right people in place to really drive you forward. So from there, college and everyone's heard this before. College for me, it was I was working baseball. I was traveling a lot. I don't want to call it burnout, but it was probably burnout. But it was one of those things where I needed to do a 180. I needed to be home a little bit more. My dad was sick at the time. So I went and took an industrial job working, and I still do per diem for them, working at a Frito-Lay plant, so chips.
Yeah.
And, one of the things I was there for 6 months. I got bored. Now I work in a high school to make it as simple as possible. But one of the things I learned from them, and I still do, is that, and this is why for any athletic trainers that are looking into the industrial setting and the military setting, which we'll talk about later, is that they do a great job of showing, hey, this is the money you get back by investing in an athletic trainer. So the high school I work at currently, I'm the first athletic trainer there ever. Crazy. It's in Baltimore, 2024, first AT ever there. And so for me, these are new positions, and I felt like I needed to make sure that they know what I'm doing. So I like doing the return on investment, but it's also total injuries going on this upcoming year. It's starting to track athlete exposures and make sure that we can compare incidence rates, things like that. But anyway, even with that, it's just showing, hey, this is how much you get back by having me here. And right, when we talk about the high school setting, I would say the high school setting specifically, we're not billing insurance. There's no ability to actually show that, hey, we're bringing money back to the school, but are we saving families? Are we utilizing taxpayer dollars efficiently when I'm hired through the school district? So that's kind of where I started off with all this, and I'll stop there to make sure I don't go too much further.
No, you're good. I wanted to learn more about why you created it, how you created it, and what are people supposed to use it for. So definitely keep rolling with that. And,
yeah. So the return on investment calculator, I've been doing this in my own setting. I didn't really have a single streamlined way of doing it. I'll be honest. I live kind of what I said, most EMRs, whether it's Healthy Roster, ATS, I'm sure there's a couple other ones I forget. I apologize to them, but they have the ability of the track billing CPT code part. Okay. But that's just one part of what we're doing and how we help save costs. Another one really is just time, family time saving. So that's something that I went with where I was like, hey, especially in my setting, I work at a high school, the kids come from all over, parents do not want to take time off of work. That costs them money, and they want to figure out how can we have our kids seen. And it's like, hey, we are athletic trainers, we are healthcare, we're public health in the high school setting. And so for me, I want to go, okay, how do I put a value on that? There's research out there. Your initial evaluation to go to a doctor's office and go through insurance and fill out everything and get everything done is about 80 minutes, 80 minutes. So the opportunity cost there is $43, what that research said. Ray et al. 2015 was the research article. And so for me, it's applying that with everything I do. Is it initial evaluation? Is it a follow-up care, especially with concussions, depending on the state and what you got to do for that? Is it how many? If they're doing full-blown rehab, hey, they don't have to go off-site to a PT clinic. And then it's, hey, depending on their insurance, sometimes there's co-pays that are pretty darn high to go to a PT clinic 3 days a week. How much are they saving with you? So for me, it's for the time savings value, it's really just the parent, how much the median hourly salary is, and then the time it takes. Mm-hmm. So I was calculating that alongside the CPT code billing match, and then field coverage costs, right? How much would it cost you to go hire an AT to cover all your stuff just in the afternoon? For me in Maryland, it's $50 an hour. So I just use that over the entire year. And then with the calculator, I also added the avoided medical costs. And that was something I'm kind of playing around with, to be honest. It's how many times can we stop someone from going to the ER and stop them even from going to urgent care? There's literature out there for ACLs. If an ACL patient goes to the ER, first off, they're only going to get correctly diagnosed 4.5% of the time. And then a visit to the ER is about $4,000 more than going the appropriate route of probably just waiting the next day and get seen by an ortho.
Yeah. Yeah. Well, and I've had a few insurance companies on before, and, I think everybody's kind of confused on how to, I don't know if it actually decreases your premium, but you get better coverage if there are some systems in place for preventative care, programming that is reproducible and is actually put into place and actually documented. And I don't think that some people take advantage of those types of costs. I don't know if you've gone into that level of things yet. I know high school, it's hard to do that type of stuff sometimes.
Yeah, in the high school. And so there's actually an article, Shanley et al. 2019. It was actually through, I want to say ATI actually, is people out of ATI. They had athletic trainers employed at high schools, and they went and implemented injury prevention programs, risk reduction programs, where you want to call them, out at every high school. They went and tracked it, and they had a 50% reduction in secondary insurance claims in their school district. So their research does exist out there to say, hey, that is something you can do. I personally have not gotten into that because I am 180 at my high school with 450 athletes. So and especially being the first time athletic trainer there, it was more so we had bigger fish to fry, unfortunately, with just making sure our heat policies and emergency action plans have been good to go and make sure that coaches know what they're doing and all that. But no, that's definitely something there. And reducing secondary insurance claims. And I'm assuming that's what you mean by the health insurance or the insurance companies when you have them on. And I think for the college setting, that's kind of the goal, to show your value as an athletic trainer. How many times can you stop, anything from hitting secondary insurance whenever you can?
Yeah. So I think one of the most difficult things is, as you identified with the industrial setting and, what was the other setting you were in? Military.
I wasn't in military, but that, if you look at the literature for military, the return on investment typically of an athletic trainer there, for every $1 invested to an athletic trainer, the company saves $7 to $9.
Yeah.
Okay. So that's a pretty high return on investment.
Yeah. So I think it's trying to translate, because there's being money exchanged, somebody being paid for the work that they're doing. I'm still surprised that this hasn't been incorporated into like professional athletics or amateur, the high school and the college. It still seems pretty difficult because I guess they're still playing for the love of the game. I don't know if that's at every college, but I guess like you had said about the time lost for going and actually getting the medical treatment at the doctor's office. Would you correlate that as kind of the same of money passing hands? Because time is kind of the similar value.
Yeah, I don't know if I would call it money passing hands in a sense, but it is just time is important. And if for me, like right when I look at time saving, I think it's a little difficult in the college and professional setting to kind of justify that because usually a lot of things are on site. For my setting in the high school, and even honestly, you could say in the industrial and military too, like if they're not having to send people off site and everything happens there, you're saving people time and money from having to take off work or anything like that. So that's kind of more so how I see that time savings measurement.
Yeah. Well, I was kind of thinking, so like with industrial setting, if somebody gets injured, you have to pay that person, even though they're on workers' comp, and then you have to pay another person to come in and do their job.
Yeah.
So the economics of that situation is a little bit different than like at the high school or college. So I was just trying to figure out how
that's a very good way to point it out for the industrial. That's why the industrial setting, it's like, if you've seen it, that's why the salaries are typically higher, right? It's because they've been able to show, hey, by the way, because we don't have to do that whole rigmarole with workers' comp and all that going on, like we are saving a lot of money not having to train someone for that job. And like you said, pay for treatment and the salary for that guy.
Yeah, because I'm just trying to figure out, we obviously know that a lot of high schools and colleges, their business structure and economics, like how do we get more money funneled into the support staff of the athletic trainer? But do we maybe need to start going on the angle of, I guess, if somebody gets injured, the chronic long-term effects of that injury, and what does that do to their career or possibly regular life? I mean, athletic trainers are really good, so I don't think a lot of people get to that point. But like, I guess it's kind of how do you know that you prevented an injury debate also? So I don't know how to spin it in a way that high schools and colleges understand, the importance of it. I'm not saying that missing athletic time is not as important as your job where you're making money, but how do we kind of spin it so that there's more emphasis, I guess, the selling points of the athletic trainer and why there needs to be more compensation to them.
One of the things I'm starting to explore at my high school is kind of, so in the high school setting and in the college setting too, right? How does athletic training employment affect academics, right? Is that a more sustainable long-term thing to look at? So in the literature and at more in the rural setting, there are school-based healthcare centers. So in middle schools, high schools, they'll actually have a full-blown doctor there. Like they'll have their general, essentially that's where their primary care physician is. That's where it all happens. Okay. You can think of an athletic trainer in a similar sense, especially, for me I work in Baltimore. There are high schools in Baltimore where a lot of the students we see, we are their healthcare. They don't get access to healthcare anywhere else. So how does that affect the student academically? In the high school setting, the big number is attendance. If a lot of schools get their funding based on attendance, the school-based healthcare centers have been shown to help improve quality of life for people afterward. That's pretty much well within. Like the goal is you ultimately have a school-based healthcare center so that it comes back to that time. There's no traveling for doctor's appointments. It all happens right there. So to me, it's trying to make that connection of, hey, an athletic trainer helps school attendance with kids that maybe wouldn't get treatment otherwise. It used to be in Baltimore, hey, kid tore their ACL, or hey, they strained their hamstring. He has pain getting around. He's just not going to go to school for 3 days. That can be detrimental because that 3 days can become 2 weeks just because of the situations they're in. If it's you can go to school and get treatment there, we get rid of that. They're still in class. They're doing better. So that's something that I've started looking into. I'm actually in talks with my school district about how do we measure that? How do we get attendance, match our injury data to attendance and see if they're missing school, if they're not missing school, and then compare based on socioeconomic status, because not all of our public schools are in the same type of status, and none of the kids are either. From the college setting, I think it can definitely be looking at, hey, who had the most exposure to an athletic trainer, and then can you follow up with the people afterwards. Like I think the alumni bases are a little bit better about following up with people. I don't know about you. Like I graduated from the University of Delaware. They call me like every month. It's insane. So, there are these alumni programs that will hunt people down for certain information. So I think from the college setting, and I think you said it at one point before too. It's just there's not enough documentation happening with athletic training. No one's it's a constant problem. To me, we have all the technology in the world now that yes, I get it. We're outside, we're covering practice, things like that. I dictate notes on my phone. Like if I'm out at a practice, I'm dictating notes. Like it just has to be something forwarded on the front of your mind in order to be able to get all that info in. And I think that's honestly part of the problem. There's a NATA Journal of Athletic Training article came out 2026. It was in the health information technology. And like as secondary school setting, it said, hey, the costs per treatment per injury, if we went through like the reimbursement stuff and whatnot, was like 165 per injury. But they went and noted like, yeah, to be honest, the documentation wasn't that great. Like it was probably more, but whoever was doing the documenting for all this, it wasn't that great. So that is probably, if there's a battle that needs to start somewhere, it's that. And because we just don't have enough data as a profession to show what we're doing. You have some people who do a very good job within their own settings and do a good job of demonstrating their value. And even in the college setting, it happens. Some people do a really good job with, hey, this is the services we're providing. Hey, this kid not going off campus, we're able to do more treatment with them here. Hey, because it doesn't have to go off campus, he's able to study more. He's able to partake in his classes. That means he's eligible to continue playing for sports. I've been out for the college setting for a little bit, so I don't know how many guys become ineligible. It always felt like a workaround. They always figured out some way to keep guys eligible. It never made sense to me, but
yeah,
I'll go off that.
Well, and that's where, I think the documentation, I think we really need to examine more as a profession, because it's not even just obviously documenting injuries to gather data, but I don't think that we're pushing out enough research either. And I don't know if maybe that's an underlying reason of maybe why we're under-respected or not undervalued, but misunderstood too, because we see so many things that are really cool information-wise, but we're not very, I wonder if that's where it puts some handcuffs on us, but making sure that you are using ICD codes and actually being able to logically put together your rehab or your treatment plan, because I don't know, it was always hard for me to document because I was doing so many things at once for that one person, and it was layering techniques where like in PT, it's very like, okay, we're going to do this one thing, then we're going to do this one thing, and then we're going to do this one thing. So it's, I'm not saying that PTs aren't doing it either, but for athletic training, it seems like, okay, it's sport specific. We have to change the rehab exercise to mimic what they're going to do out on the field. We're going to do treatment at the same time. It's so complex that an ICD code's not necessarily going to capture what all you're doing. But yeah, I think we need to re-examine that a little bit more on how we're collecting data and where it's going and what we're utilizing it for. Because I don't think a lot of places actually look at the data after the year or the season either. It's kind of just there for liability reasons.
Yeah, and that's the problem. And you can do a lot of good quality improvement projects, essentially. I was just looking at our data as a district, and this quick example is, who actually has the highest hamstring rates across the district by like 3 times everyone else is track and field. Maybe we just incorporate Nordic hamstring curls as part of their warm-up 2 to 3 times a week and have them progress it. Most track coaches are pretty into that stuff specifically. I think this is something we could do. And right, that if we just because we document as a district, that's great. I think what you're talking about too, the complexity of some of the rehabs we do definitely gets lost, and how you show that complexity, right? That's going to escape your typical ICD, CPT codes and all that. Like you're not going to be able to show every little thing that you're actually doing there. And so it might have to be certain case examples that you display. So like for me personally, like every year I don't just send, I have a supervisor who's an athletic trainer, but I send to my principal and the athletic director hey, these are all the injuries we saw. These are, everyone's always interested in concussions. These are the concussions we saw. This is their average time missed, all that stuff. Hey, we were able to manage this kid, not just a concussion, but also academically, and make sure that, hey, they were taken care of from the school standpoint. And kind of going off, like, people don't realize everything that we do. I look at, I don't know, shoot, I think I look at 500 plus physicals a year. I also help make sure that kids get physicals. In Baltimore, we have a bunch of free opportunities, low cost opportunities. Those are things that ATs might not think about, that, like, I'm actually kind of providing a really good value and helping people navigate healthcare by getting access to some of this stuff. For high school wrestling, we have to do weight certifications.
Hmm.
Like, we could do none of that, and they could go to a doctor's office and spend $75 to get weight certified by a doctor who honestly probably has no clue what they're looking at. They're looking at the body fat percentage. So it's, hey, that's a free service that we have figured out how to do within Maryland that kids do not have to pay for. Across the district, it was 400 wrestlers, I think. And, that's probably a common number across most school districts in Maryland. So I think you hit the point of, people do not realize the amount we do. How do you show all of it? And, like, right, going back to this return on investment calculator, that's the goal. And I'm going to tell you, this is not perfect. There are many things still wrong with it. I was even just looking at it today, and one of the codes is for strapping and taping. And I'm like, yeah, that should not be the code that counts for taping. I got to go change that. And, it's to get you people thinking of, am I actually showing everything that I'm doing? Am I showing that, hey, I am actually providing a legitimate value? Because I don't think a lot of athletic trainers even know where to start. They're not taught
Hmm.
it. You have to, you just have to have a self-interest and go after it. And then, how do you show it to everyone else? How do you present the data that it's easy for people to take in? I love reading a 40-page executive summary report. My principal will never read that. So, how do I get that down to a 5-page bunch of charts and graphs that it's very easy for him to understand?
Yeah. Well, and that's where, we have that research class for a reason in our programs. How do we get people to take more advantage of it? Because, I mean, I'd say, a majority of the athletic training population does do per diem. And that is the easiest way to get information, technically, because you're not necessarily doing a full job description of a traditional athletic trainer. It's keeping track of the tape, the incidence responses, and then, how many referrals are you putting out? Like, it's pretty basic information at the end of the day. Like, how have we not captured that portion of athletic training more readily to be able to determine what hourly rates are for per diem? I still think it's kind of a crapshoot on how we're calculating these numbers. And it's very frustrating for me of the logic behind it, because how am I supposed to negotiate it and put evidence behind it when I'm glad that people are just throwing random numbers out there and they're sticking. But when you come across business-minded people that are trying to protect their company and, their ROI, like, how am I supposed to facilitate those conversations and explain why I'm worth this much to that company, with the liability risk,
Mm-hmm.
the longevity of the athlete, making sure they get follow-up after the event, those sort of things, so they don't have to worry about it. So those are the types of things that, we just kind of throw stuff against the wall, and it's kind of annoying as an athletic trainer.
No, it is. Yeah, it's the per diem stuff too, and it's like, the kind of ways I get where they're coming from. When someone says, "Hey, you're getting paid 50 an hour," but all they see is you standing at the field. Yeah, I could understand why they'd be pissed off. They just paid you $1,000 to maybe see 3 people. But if it's
Mhm.
like, hey, I'm here, that's risk and liability. I don't know how their insurance works for them, but you should, kind of what we talked about before. If you say, hey, I hire athletic trainers or medical coverage for events, I would assume your insurance rates will go down, knowing that someone is there help protecting that. And then I think kind of what you said too is, most athletic trainers don't do this. But if you're saying, hey, I'm providing per diem, and I will also follow up with each person after the event, and, like, that can be a business in itself,
Yep.
right? Like, you start going, hey, you sprained your ankle, would you like some treatment? This is a cost for my services. Is that something you'd be interested in? A lot
Yeah.
of that, I would venture to guess almost no athletic trainers are doing that in the per diem setting. I could be wrong, but, that's something, I don't really do too much per diem anymore.
Mhm.
But, that's it's good customer service, and it's convenience, right? It's going back to that. Hey, that is time saving for that parent. If you're already there talking with them, giving them guidance, they're like, this is great. Oh,
Yep.
you're telling me I don't have to go to the doctor for this ankle sprain? Thank God. I got 3 other kids that I don't have time to take little Timmy down the street to primary care. So I think that is something that, from a per diem standpoint, it is tough to kind of show what is the total value you're bringing. And what you said is like, it really is just kind of made up. Like I've never, no one can really give a complete reason on why it costs. But I
Yeah.
think as athletic training, as are even like, with the entry level masters, we're learning more skills and things like that. I think they're starting to see like, oh, athletic trainers can do more than just, I hate to say it, like when I first got to my high school, it was just, oh yeah, you're just gonna give us an ice bag, right? And it's like, no, there's a little bit more that I can do than that. Okay, and I think people are starting to see that, and I think that aftercare part of it, where a place is saying, hey, we have this service, and I think, and you're starting some people. Starting to see some more people do this, more ATs do this, of essentially providing care for a sport club or organization, where it's like, hey, I'll provide per diem coverage / I'll also provide like coverage for injuries after the fact, or treatment for that. And so I think it's hard to justify the numbers, but it becomes one of those business things where you give. People just go, oh, that 50 an hour really kind of seems really good now, because you're just doing a general service for our entire club.
Well, right now I've been trying to dive into how California Athletic Training Association developed their recommended hours, because I know that's a hot document out there. And basically they took the average of per diem rates across the country and then did a multiplier of cost of living in the areas. So that's how they got the districts breaks out. And I'm just like, I'm assuming that athletic trainers really suck at math. Why do we keep using the averages?
That's why I was like, that doesn't make any sense. Yeah.
And that's even with the salary survey that just came out by NATA, it's averages. And I'm just, in my mind,
they don't want to show
understand.
the other. Not to be that jerk, I don't know if they want to show the other number. I don't know if
I
they
don't
want to
think
show
so
the median
either. And they should be showing the range that they're gathering this data from too. And that's where it's, do we want to keep pulling the wool over the eyes, whatever it is? Like, we have people that actually understand math and the data sets. Why aren't we providing that information? So yeah, and like you were saying with the follow-up after events, I mean, I'll put it out there. Sign up for Wave On, have your QR code there. If somebody gets injured, have them sign up for it and you can continue the care and get paid for it. Or if you're really good at negotiating or you're really good friends with the event that you're working, get that, how to stifle that off the back end of the event of following up and, making sure that they're actually getting referred properly and getting cleared properly. That's, I think, the biggest thing that's lacking in most of these organizations. And that's where, I mean, some athletic trainers are starting to do club coverage. So they're responsible for a club. But before the event, how do you not have a medical coordinator before you put on a tournament to be able to talk about the liability and look into the insurance coverage? Somebody that somewhat understands that. I wouldn't say that I fully understand insurance, but if I got more involved, I could be pretty expert.
I don't think insurance doesn't fully understand insurance.
Yeah, that's true too. But I don't think that's the thing with the business mindset of an athletic trainer is there's so many ways to make money and we are not taking advantage of it. We have the skill set to take it off somebody's plate for a huge, US soccer event. These places that are reproducible events, how are we not involved beforehand and we're just showing up right at the start time? I still don't understand that.
Yeah, it just takes, I don't want to use assertive. You just have to be assertive, and sometimes it is simple. I know we just went on to the business side of the stuff, but like some of it is just put yourself out there. Like if you have you'd be surprised too. Like if you already have a relationship with whatever sports or organization you're with, and you just go, "Hey, I'm starting my own thing. Like, would you want my service?" You'd be surprised. People want to see you succeed, right?
Yeah.
And that's even like some of the stuff I've been doing on the side myself. People like, it's always the first people you probably always start working with are people friends, family, colleagues, whoever it is. But yeah, it just takes putting yourself out there and seeing it. I've cold called places to be like, hey, do you need service for an athletic trainer? Is there anything I can provide you? I think a lot, and like you said, there's a lot of money to be made.
Mm-hmm.
The you know, if talking about the health economics aspect of it, I think you hit the nail on the head perfectly. It's like, hey, if you're actually there guiding their care from a health economic standpoint, and we're saying, hey, we're utilizing limited resources to have better access, quality of care, and affordability. You directing them the correct way is going to grant all three. They're not going to waste their time going to doctors they don't need to go to. They're not going to waste money at those doctors that aren't going to get them the answers. But if you're able to connect them to the right spot or not even send them at all, and, I don't know what, right? And then it's like, how do you justify what you're charging? What do you want it to be? If what in your life, if it's going to be a full-time job, do you need to make per hour worked for it to make sense? And I think, sorry to,
Nope,
before
you're
I
good.
go here, even with all this return on investment stuff, we're talking about services provided. I didn't talk
Mm-hmm.
about the outcomes.
Yep.
What we have to sell is what is the outcome that you're selling. And when you start telling people, hey, the outcome is you're going to get high quality care and you will get out of pain and get back to sport faster, they don't care about the money. Like, a lot of
Mm-hmm.
people just want the answers and the answers quick.
Yeah. Yeah. Well, how many times do you have a concussion kid at an event and can I just go get it checked out by the doctor to get clearance to come back tomorrow and play? Like, that is the main motivator, is getting back on the field or court or whatever it is. So how do you help facilitate that much faster? I mean, concussion's obviously a odd example, but how do you get them back in a week after the event to be able to start practicing again? And I don't think we're selling those types of tidbits.
I mean, and like, that's what I have my parent. It's a weird thing to traverse with parents. And I go, because it's like, I'm not trying to tell you not to go to doctors. I'm just telling you, have them see me first. Because when you go to non-sports medicine doctors, they're just going to write you out for 2 weeks. Not all of them, but a lot of them do. So like, right. And then, there was a kid last year, sprained his wrist. He had a previous history there. It's always why I sent him back to his old doctor. And they just said, we'll keep him out for 2 weeks. He was better in like 3 days. And so I was like, hey man, I can't help you. I can't override this note that says you have to be out this long.
Yeah.
But that was one of those examples of like, shoot, this sucks. Now this kid's just sitting around not doing anything because he saw the wrong doctor, apparently.
Yeah. Well, and I don't think that we sell enough that we don't have, well, obviously we need an overseeing physician, but we really don't have any gatekeepers like physical therapists do. Most of the time you need written orders to be able to go to physical therapy, obviously to use insurance, but we decrease that ladder of referrals of, now I can sit here and evaluate and we can go directly into your rehab where you have to go get evaluated. Then you have to go to the PT and then maybe a specialist, whatever it may be. And then the brace specialist, and it's an all-in-one approach. And I don't think we're very good at articulating that to anybody. And, that's where we're faster as a specialist, is we're the all-in-one. We can start you right into pain management and your rehab to start getting better with the evaluation all in one swoop, where it's very segmented when you get into the healthcare system.
Yeah, and like, even if it's, let's say it's a longer term injury, or like, hey, they're going to need surgery, I don't know an AT that's against, hey, I'm in a high school. I personally do not do too much long term care, and so anytime I get a kids, I kind of do rehab with you. I will also be like, yes, of course. However, I'm still going to have you go to physical therapy, mainly because I end up having to wear too many hats at my high school. And so I think part of that too is just saying like, hey, we will do the majority of care, and if we feel like you need extra care, we'll refer you out and we'll get you to the right person. We're not going to, insurance depending, you're not going to go to your primary care first if you don't have to, or if you're going to go to your primary care, like, just get the referral so that we can send you to the people we know in the area who we've seen multiple times before who do well with injury rehab.
Yeah. Well, and I think it's such a fine dance too, is that a lot of athletic trainers feel like they have to do it all. And it's like, nah, if you can refer out, I would do it to the best of my ability if, the patient is willing to do it. You don't need to be working with 10 athletes at once. I think if, you have somebody, even if you made a partnership with a physical therapy clinic to come work with 2 to 3 athletes at a time in your athletic training room, I don't think ICD codes dictate where they have to do the service, but I don't know it that well.
No, it's working the college thing. I was a rehab coordinator where I was at, and oversaw surgeries and whatnot. It would be funny because there would be times where I'd be overseeing one, and I said, "Hey, you're in season, like you're doing a lot of in season stuff right now, and this kid is 3 months ACL. Let's have him start going to physical therapy." And it was always a fight. I think it's because a lot of athletic trainers, they don't want to let that go. They there's an ego. It's probably especially in the college setting, an ego of like, no, I can handle this. I can do it all. And there's nothing wrong with pushing it off to the side. And to be honest, right, that goes back to that. No offense, that might be a better quality of care during that phase of rehab, right? And then, hey, when you're out of season and that ACL is 6 to 7 months, getting into more functional stuff, it probably makes sense to go back to you. You have more of the resources, more of the time to do the one-on-one stuff. Where the PT clinic probably doesn't have the space that you need to start doing some agility drills.
Yep. Yeah, I think athletic trainers really are in that bridge of returning from rehab to performance. And physical therapists, I think there are some that know how to do it, but then insurance gets in the way, and they only have so many times they can see this person. And, you need someone eyes on while they're doing the more technique driven drills and exercises and stuff. And I don't think athletic trainers necessarily sell themselves on that either very well.
It's a very, very easy thing to say. Be like, hey, I bridge that's a slogan. Like I bridge that gap from physical therapy to performance. Like,
yeah.
And like there's physical therapists who do that. A lot of cash-based places essentially provide that service, but really athletic trainers are in a great position to do exactly that.
Yeah. So back to your calculator, what kind of information does somebody need to be able to use your resource right now?
Yeah. So right now, you really just need to collect patient encounters. And then from there, it's just, you can add the body part and the side and all that, and it'll give you some total counts on how many knee injuries, ankle injuries you saw. The biggest thing is the encounter type, and that's kind of where it automatically matches CPT codes, so it can give you a reimbursement value. So, was it an evaluation, follow-up? Was it general rehab exercise you did? Was it a modality, e-stim, ultrasound, if that's still happening? It has to be one of those types of visits. There's a couple other things that are neat to put in there. So for me personally, and one of the things I put in there is, was there an outside referral? As in, did you manage this case, whatever it was, did you manage this thing on site or not? Okay. And so, just to show how much you're actually referring out. So like for me, I think I referred out 5% of my injuries. The data tells you for high school, it's around 18%. For colleges, it's like 45 to 50%, which that's just how they roll. They're having kids get seen for most injuries in the college setting. That's all there really is to it. There's actually a template you can download from the website so that, if you don't have a way to collect just regular patient encounters, to be honest, I do use a Google form. It's really just a check-in sheet for my kids. And then I just alter it to make sure that, all right, get rid of the name, make sure that there's no identifying data with it. The calculator, I also made sure that it doesn't get uploaded to a server or anything. It's all local on your tab and browser. So even if you did, for some reason, just leave all your patients' names in it, it's not going anywhere. There's nowhere for it to go. But and then the last thing you need is just how much field coverage you provide. So, for me at the high school, I think I averaged like 18 to 20 hours a week of field coverage from August to end of May. So I was like 580 hours for myself personally. So that's about all you need. It really isn't much. And it's one of those things that you can have your athletes' patients do. Like if you set up a sign-in sheet or a QR code and it goes to it, a lot of these EMRs have a kiosk login if you even want to figure out how to work with that. I live in Excel and Google Sheets mainly because I like the independence I have with manipulating data from EMRs. So that's kind of the reason why I did this. Was I wasn't able to get the exact report I wanted from my EMR. So I said, I want to build something that other people can even use, or at least think about, start talking about, of, hey, how do I how do I think about this in my own setting? So it really doesn't take much. And that's all I want to overemphasize is you can do it pretty easily. And now this is what I will say. This is probably the lowest value you could actually say you're providing, right? When you
Yeah.
go and put all that in, because right, when you do rehab exercises, you could probably build 2 or 3 units of rehab exercises when someone comes in, especially if it's something like a 30 to 45-minute rehab. It's usually 15-minute blocks, 8 to 15-minute blocks. That's not how I'm doing it. I'm just saying rehab exercises counts as 1 unit block.
Yeah.
So, and this is also based on Medicaid and Medicare reimbursement. First off, athletic trainers aren't recognized by Medicaid, Medicare. So yes, that doesn't make sense, but we have to compare ourselves to other health professions somehow. But you got to remember, other insurances probably reimburse much better than Medicaid, Medicare. There's a whole wide range. I have a friend of mine, he's a AT chiropractor, and he kind of talks about how the chiropractic world works. It's like you can have 2 ways. You can either be cash based and charge a lot, or you're a mill, right? You're just having people come in and out. The cash based charge a lot, right? You're going to be seeing wealthy people for the most part. The other one, you'll see people all over. And the hope is that you get a wide ranging of the Medicaid, Medicare that barely reimburses them, or some of the health insurances that barely reimburse, and other health insurances that are reimbursing $400 per visit. And that's how those 2 games play. So even with this number, you could call it a sensitivity analysis. If you look in the health economics research, it's kind of what they call it. It's like, hey, your range could be if rehab exercises get reimbursed for $20, or it could be up to $80. And so, like, I didn't really put that in this calculator, but I would preface say this is as conservative of an estimate as you can get.
Yeah. It should be giving you a starting point.
Yes.
Because even for the on-field hours, I was like, well, wouldn't you want the in-clinic hands-on hours? But I'm sure there's a reason why you used on-field for emergency response.
Yeah, it's that. It's more so that. Like, it's saying, hey, when you're doing the field hours, you're probably, like, in that emergency role. Like, right, you're that strictly per diem role, where if you're the clinic, that's where all the billing stuff is typically
the money
going
generation.
on. Yeah, exactly. That's if you want to look at it. Yes, exactly.
Okay. And where do you see this going? Is it free? Are you trying to maintain it free, or seeing if somebody will buy it and implement it?
Yeah, I think the goal, it's free. Honestly, I'm just trying to get people talking. I'm just trying to get athletic trainers talking and thinking about it. I actually, you have to input your email for it, and then I put you on an automatic email drip, essentially just talking about, hey, this is what return on investment is, this, that. Ultimately, my ideal world would be, hey, how do we create like an athletic trainer return on investment group, business group, something like that, where it's just like, just be able to have conversations around money half the time, and I was there too. Like, I didn't know how to negotiate. I didn't know how to talk with people. I'm in a better position now where I'll do an interview and it'd be like, what's the salary? They're like, oh, it's commensurate spirit, but well, I'm not going to go forward until I know the salary, because I don't want to waste your or my time, right? When it comes to that, when it comes to offering my services on the side, I just go, this is the price, and they go, oh, I don't know if I can afford that. That's fine, right? Like, that, you just have to figure out who truly values what you do. So ultimately, my goal, it's showing the return on investment stuff. I also want to figure out how do we just get athletic trainers better at documenting it. And and this could be a quick thing here. I've heard it from all stories, like, all right, do we want athletic trainers with Center Medicaid Services, CMS? Do we want recognition, Medicaid, Medicare? I've heard both sides. I've heard, like, yes, because we want to be recognized as a profession. That means greater access to everyone for athletic trainers. Other people go, but then you have someone else setting a price on your value. It depends on who you talk to. I would say most athletic trainers don't know how to set their own price, and so they would rather it come from someone else.
Yep.
And it's one of those things where I just want to make sure people realize those are some talks that they can have, and it's, how do I set your own value? Is that something that we actually want to happen as a profession? I think a lot of people do. There are states with that insurance do recognize athletic trainers. They're able to reimburse. I will say NATA, Journal of Athletic Training, they did publish one. There's a physician extender setting and how they utilize ATs in physician extender role and how they're able to reimburse. There's also in that same issue, there's a college that tried to do it. They were doing it through Epic. Epic's a hospital-based EMR, and that article is actually pretty funny because they went through it's a peer-reviewed article. This is why I always say just read the entire articles because you just get a lot of funny tidbits in it. So they had 5 years of data of being able to figure out how to get reimbursed for services. The first 2 years, $6,000 each. It wasn't much. The third year, they got it up to 35,000 or something. It's okay, they're making progress. I can't remember how many athletic trainers. The next year, it dropped back down to 15. And it's what happened? College, they can't keep athletic trainers around long enough. So the process it took to train everyone was those 3 years. And they had people leave. So then they had to restart the whole training over again. So
Yeah.
that's what the only reason for me for when it comes I want to be recognized Medicaid, Medicare, it's access to care for other people, but it's just to force us to document. That might sound crazy, but it's right now there's no one really saying outside the risk and liability. There's no, as long as you wrote down you did something, you're fine, but you don't have to worry about the hows, the whys, and the whos when you write. And that's probably something that we as a profession need to demonstrate our value.
Yeah. Are you going to pull any information from what you're gathering on the back end? Or I guess you said that all the information
all local
is
to the browser. Yeah, I did that on purpose just because I didn't want the HIPAA stuff. Would that ultimately be a goal? Yes. That's just going to take a little bit longer to build. So I'm not quite there yet.
Okay. Well, I think this is a good step. You'll probably get people arguing with you on how you're setting up the equation, but at least it's a start.
That's already happened. Don't worry about it. And it's that's why I have to keep saying I'm sure. Hey, this is all self-taught at this point. I have not taken any courses in this. I don't have any mentors in this. This is me just doing it. And I'm sure someone who's more well-versed in insurance will eventually come through the way and be hey, that's not how it would happen. That's fine. Tell me. Let's have a conversation. But don't just, it's the same thing when you're in a setting, you complain about your salary, but then you can't show what you do and all you do is complain. That's not going to go anywhere. You got to figure out why is that not going anywhere? You got to give a little more context.
Yeah, that was what I was trying to do. My doctorate capstone was trying to figure out an equation based on, general economics of how do you set or how do you negotiate your salary or pay rate? How much is education, how does that translate to a percentage from minimum wage? How many years experience, and then healthcare.
Mm-hmm.
Obviously, I fell into this podcasting and talking about it because there's so many rabbit holes on how you can calculate it. So that's where it's, your value is very personalized.
Mm-hmm.
So that's where I think athletic trainers, it's kind of a crutch we go on is, somebody has to figure out how much we're worth. And it's it's on you.
It's on you. It truly is. And even then, even with the stuff I've sent to other people about how much value we're providing or whatnot, as long as you justify it, no one asks, no one questions it. As long as you have a description of, hey, this is the reason why I believe I'm worth this. Most people that I've encountered that are not athletic trainers, they're your stakeholders. They go, that makes sense. There's no fight back on it.
Yeah. So I wanted to be respectful of your time, but was there anything else we want to throw in? This is probably another podcast to keep going on some of these other things.
It could be, even the hey, should we be recognized by Medicaid, Medicare, or whatnot? That could be a whole one by itself. And I'll be honest, I'm not well versed enough to even talk about it.
Mm-hmm.
This would be a quick thing if anyone's truly interested. So they post annual policy changes every year, and you can actually make comments on it. Obviously, athletic trainers aren't mentioned, but some of the stuff they're talking about is, hey, we want to look at providing greater access to people.
Mm-hmm.
You can make a comment and say, hey, athletic trainers are healthcare professions that are not currently recognized by Medicaid, Medicare, and they could provide value. Will you get a response? I don't know. You don't know unless you do it. So that's kind of how I look at it. But I think it's a good document. Even if you don't want to read it, just chuck it into Claude and say, hey, give me a summary on how this might affect me. It probably won't, but hey, it'll relate something to athletic trainers at the very least. But yeah, the health economics side of it, and I would say, leaving with this, when it comes to athletic trainers, I think the profession is switching. You could tell me if I'm wrong here. We're switching to we are more, I would like to say the better aspect is we're public health, and we provide, it's non-traditional care, but we provide value in a non-traditional sense that is quality, affordable, quality, and it's high quality and affordable. And that's probably the biggest thing that we have to start going off with.
Yeah. Yeah, I'd say that the structure is basically universal healthcare. So anybody that's for that, we are the petri dish of universal healthcare. But guess what? We're not getting paid very well for it. So would that work on a larger scale?
Yep.
So yeah, I think the Medicare, Medicaid thing, I think we should be accepted into it. Doesn't mean that we have to use it, but I do think it would help some of the different settings and being able to make money and be able to pay for the services that are being rendered.
I think a lot of PT clinics and hospital systems go, this makes way more sense now when it comes to hiring an athletic trainer.
Yep. So, well, thank you so much for being on. This was a great conversation, and it's so complex, but we have to start somewhere at some point.
Yeah, exactly. And just my biggest thing, just talk to people, ask questions, and I'm sure you get random DMs and things like that about certain things. The same thing for me. I answer probably everything. I'm not going to say most. It's probably everything. So it's like everyone's pretty accessible.
Yep, definitely. So yeah. Well, I hope to have you on in the near future so we can talk more about this and dive into solving the world's problems in athletic training.
Yeah, sounds good.
Yep. Well, thank you so much.
Yep, no problem.
That's it for today's episode of To the Bone. I hope we've sparked some new thoughts, challenged your perspectives, or simply reminded you to dig a little deeper. Remember, life isn't just about what's on the surface. Sometimes you've got to cut deeper and get to the bone of what really matters. To the Bone podcast is a product of Daly LLC. It's hosted and produced by Shelby Daly, ATC, and Randy Daly. No clinical decision-making should be based solely on one source. While care is taken to ensure accuracy, factual errors can be present. For more on the show, visit www.tothebonepodcast.com. If you enjoyed this episode, be sure to subscribe, rate, and leave a review. Get involved in the conversation. You can find us at www.tothebonepodcast.com. Drop us topic suggestions or be a potential guest. We're all about connecting with you, our listeners. Until next time, stay curious, stay grounded, and keep cutting deep.